Hey folks, Howard Lux, sports medicine doc, somewhere in New York in Westchester County. This is the season for a number of us runners. Really, it's the end of our season. We've come through the New York Marathon, Philly Marathon, or if you like me, you finished up on a number of trail races. Our training might cut down a little, but many of us tended to overtrain. I'm starting to see a fair number of people in the office now with pain in the front of the knee. So runners with pain in the front of the knee, we refer to that as a classic runner's knee, also known as anterior knee pain syndrome. Now, word of caution, beware of anything in medicine that's called a syndrome, because that implies a bit of mystery and we're not quite sure what's going on. And it's a fairly applicable term for runner's knee, because in a runner's knee, we're really not sure what's going on. In a classic runner's knee, there really are no structural abnormalities. How could that be? And it's true. There's no structural abnormalities in a classic runner's knee. We can get an MRI. Perhaps it'll show a little bit of chondromalacia, a softening of the cartilage under your patella, but that's likely not the cause of pain in your runner's knee. Your kneecap or patella is tracking normally. It's sitting in its groove on the femur. Your menisci are fine. There's no signs on your x-ray or MRI of osteoarthritis. An MRI is not particularly useful in the evaluation of a standard runner's knee or anterior knee pain syndrome because, as I said, by definition, there are no structural abnormalities. The runner will complain of pain isolated to the front of the knee. It typically does not involve any snapping, popping, catching, or locking. The typical runner's knee is not swollen. It doesn't swell with activities. If it does start to swell with activities, then you probably don't have a runner's knee. You might have some arthritis or something else. That's the cause of your pain. Now, anytime we see someone in our office, we have to come up with what we call a differential diagnosis. That's a list of possible diagnoses that you might have that's causing the pain in the front of your knee. So high on that list is osteoarthritis in the front of your knee. It can start at a young age. We call the early form of osteoarthritis chondromalacia. In its severe form, chondromalacia might cause pain. It will also cause some swelling and a lot of clicking on the front of your knee. Also in the differential is something we call a plica syndrome. Plica tends not to produce pain directly in the front of the knee, but it's just off on the inner side of the kneecap. It's due to a little thickened structure inside the knee, which by chance we call a plica. That's very rare and not a common cause of pain in a runner. Patellofemoral joint, where your kneecap is not aligning correctly. It might be tilted or subluxating or completely dislocating. That's not a runner's knee. That's patella malalignment. So again, a classic runner's knee. You have no abnormality that we can find on physical examination of the knee itself. Interestingly, the literature or the science around this shows that those of you with a runner's knee tend to have weak core and hip muscles. You have weak hip abductors, more particularly the gluteus medius, and you have poor core control. So if we ask you to stand up on one leg, your pelvis will drop. If someone videotapes you, we see an excessive pelvic drop as well. We don't know whether hip or core weakness caused the runner's knee or the runner's knee led to the onset of hip weakness. We simply know that hip weakness is found in association with those of you with runner's knee. So the good news, many of you with a runner's knee are going to recover. Again, there's no structural abnormality in a classic runner's knee. Most of you are going to respond to a strengthening program that focuses on your core. So that's lots of planks and all the variations thereof. And it's going to focus on the gluteus medius. So to isolate the gluteus medius, you're on your side and you're lifting your legs straight up to the side. That's about as good as it gets in isolating the gluteus medius. performing squats and lunges and other activities that'll activate the gluteal muscles is also key in your recovery from a runner's knee. Again, most of you who have a runner's knee or anterior knee pain syndrome are going to recover. This is not a terminal diagnosis for the runner. This is very common in this time, especially up here in the Northeast, where we all just came off of preparing for a number of long runs. I hope that this helps you conquer your runner's knee or better understand your runner's knee. Look forward to the next talk, and do me a favor, send some suggestions or some questions you have for topics of the next live video. Bye.